Bismillahirrahmanirrahim. I am Dr. Muhibbullah Wazir. We start with the upper limb. Now this whole is the upper limb. Now, and this is the lower limb. This is the lower limb, and that is the upper limb. Note the point that the upper limb is to perform many important, sophisticated, and complicated and artistic type of functions. For example, writing, stitching, okay, and then gripping. These functions are being performed by the upper limb, especially at the hand, while the lower limb, which is more powerful of course, but it is not so tactful, not so clever. It has to support the body and it has to carry the body, but the upper limb is specially meant to grasp and to do fantastic and complicated functions. Secondly, the hand part of the upper limb, especially this palmar surface, it is richly supplied with nerves, and that's why the tactile sensation of the surface of the hand is more than any other part. It is because of this reason that without looking at any object, and if you keep it in your hand and you feel it with the skin of the palmar surface, because of the rich nerve supply, you can identify that object without looking at it. While with the help of foot or with the help of any other part of the skin, you can't identify. That is being called as stereognosis. Okay, now this upper limb is being divided for descriptive purposes into number one, this pectoral region, this region. Pectoral region is the thoracic region, but this part is being studied this with the upper limb for the reason that some of the muscles of the upper limb, which are developmentally the muscles of the upper limb, but these muscles are being migrated over here for some functional reason. And in this area, you can see two bones. One, you can see this sternum, the anterior substance, and secondly this bone, the clavicle. Look, this clavicle bone you can see, but arranged in such a way that the medial third of the clavicle is convex forward and the lateral third is concave forward. And then you can see, if you remove the muscle, then you can see the ribs. But note the point that these articulate with the sternum, not directly but through the cartilages. Each rib articulate with the sternum through the cartilage, which has been called as costal cartilages. So in this way, over here, in this pectoral region that we will study, okay, and then these muscles and the other parts which we'll study later on. Then the next part of the upper limb, that is being called as shoulder region. As the name indicates, this shoulder region. And in this shoulder region, you can see over here, in this shoulder region, you see again, follow the clavicle, and you will find this clavicle articulates with this scapula, or the girdle bone. The clavicle at its lateral end articulates with this acromion process of the scapula. Look, this is the acromion process of the scapula, and the clavicle articulate over here with the acromion process of the scapula. And then At the shoulder, again, you note the head of the humerus, it articulate with this glenoid cavity of the scapula to form the shoulder joint. And then you look, the part of then the upper limb from the shoulder to the elbow, from the shoulder to the elbow. This part is called as arm or brachium. From the shoulder up to the elbow, this part is called as the arm or the brachium region, and it contains this humerus bone, or you say this humerus bone. And this humerus bone at its upper end articulate with the scapula to form the shoulder joint, while at its lower end it articulates with the radius and ulna to form the elbow joint over here. And it consists of this arm or brachium, it consists of this anterior or flexor surface and this posterior or extensor surface. And then the part from the elbow up to the wrist, this part is called as forearm or antebrachium. And the point is that the forearm or antebrachium, it is having two bones. The lateral one is the radius and the middle one is the ulna. The lateral one is the radius and the middle one is the ulna bone. And that's why this border of the forearm or antebrachium, that is also called as radial border, and this border is also called as ulnar border. And again, it consists of this flexor surface and this extensor or posterior surface. Then at the lower end, there is this part which is called as wrist. And this wrist over here, it consists of these 8 bones you can see from lateral to medial: scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate and hamate. There are 8 bones arranged in 2 rows, proximal row and distal row. Proximal row consists of scaphoid, lunate, triquetrum and pisiform, and distal row consists of trapezium, trapezoid, capitate and hamate, and these are carpal bones. And then the carpal bones, look, the radius and ulna at its upper end articulate with the humerus, and then the 2 bones also articulate with one another to form the superior and inferior radioulnar joints. And then the radius, you look, the lower end of radius is much bigger than the lower end of ulna, and it is only the radius that articulate with these carpal bones, not the ulna. Note the point. At the wrist, only the lower end of radius articulate with the carpal bones. And then the hand, look at the hand, it consists of, again, look at the hand, it consists of, number 1, 5 metacarpals, metacarpal 1 and 2, 3 and 4 and 5th. And then the digits in the fingers, look, this is the thumb, and this is the index finger, this is the middle finger, this is the ring finger, and this is the digitus minimus or little finger, each having 3 phalanges. 1, second and third, while in the thumb there are 2 phalanges. But point to be noted over here that the thumb surfaces of the thumb. Look, this is the anterior surface of the fingers, while this is the anterior or ventral or palmar surface of the thumb, which is facing at right angle to the palmar surface of the other fingers. And that's why that is the function of opposition of the thumb. Very, very important for grasping, for writing, for stitching, doing operation, or any other point. If the thumb is lost, think that the whole of fingers are lost. Because without thumb, you can't grasp or you can't hold the structures. And it has also noted the point that the thumb is having a great presentation in the brain, because the thumb is to have to perform many functions. All right. Now note this point, that the phalanges articulate with the metacarpal bones. Metacarpal 1 and metacarpal 2 and 3 and 4, these metacarpal bones. Metacarpal bones. And then the metacarpal bones articulate with the carpal bones, these 8 bones. And then out of these 8 bones, the lateral metacarpal, that is scaphoid and lunate, it articulates with the lower end of radius. Now this point should be noted, that if you lift the weight in the hand is being transmitted through the radius to the other limb and then to the axial skeleton, not through the ulna, because the ulna do not have any articulation with the carpal bones. I hope you got it. Secondly, if you fall on the ground at the outstretched hand and the hand touches the or hits the ground, the force is again being transmitted to the radius, not to the ulna. Because of this reason, the fracture of lower end of radius is more common than that of ulna. This is the point. And then you note, then the radius and ulna articulate with the humerus. And then note the point that the humerus articulate with the scapula. And then the scapula articulate with the clavicle. And the clavicle articulate medially over here with the sternum. In this way, if you lift the upper limb and weight, this weight is being transmitted through the scapula, through the clavicle, to the axial skeleton. It is the only articulation of the upper limb with the axial skeleton, and that is indirect. That is the clavicle with the sternum, and the clavicle with the acromion, and the scapula with the head of the humerus. This is indirect articulation, and the weight is being transmitted over here to the axial skeleton from the upper limb. Then you look over here. That just above the upper end of the sternum, you look at this diagram. Look, just about the upper end of the sternum, over here in this area, you look at this area, look, just above the upper end of the sternum, or over here, you note in this one, you note in your own body, over here in this area, there is a notch which is called as jugular notch. This is jugular notch. Then the clavicle is being represented like this, that it is convex forward. You look at your own, each student, you palpate your own clavicle or that of your colleague, that it is convex forward in the medial part and concave forward in the lateral part. And below, in this area, below this concave part, this part is also called as infraclavicular fossa. And if you look in the infraclavicular fossa, the important point is Important part is, look, this is the lateral part, this is the infraclavicular fossa. Deep in the infraclavicular fossa, you can see this bone, which you can feel with the deep palpation. This is actually this coracoid process of this scapula. Okay, over here in the deep palpation, over here you can feel the coracoid process of this scapula. All right. Now, look, you concentrate at the pectoral region, this region, pectoral region, and you look, the skin, the first organ that you see at the pectoral region, that is the skin, and the skin of the pectoral region is the same as elsewhere in the body, that is having epidermis and dermis, and it is hairy in male and non-hairy in female, and it is more hairy in some people and less hairy in some people. But the only change at the skin of pectoral region which is not present in the skin of other part, that over here there is a rounded, pigmented, pinkish or blackish rounded skin which is called as areola, and this is areola of the breast. And then you can see at the center of areola a small projecting nipple, and this projecting nipple is it is not developed in male, but and also not developed in pre-puberty female, but this nipple becomes more developed in the puberty, after the puberty, and then more prominent while the female is lactating or giving milk to the child. So the only change, the only specific modification in the region of pectoral region, that is the areola and the nipple, which we will study in detail in connection with the breast. But this you can see, and this you can see that of one another as well. Okay, then when you remove the skin, then when you remove the skin, then you will see that the skin is being connected by small fibers. You would have seen when the skin is being removed from the animal in butcher house or at your own house at the Qurbani Eid, that while you are removing the skin, there are fibers that connect the skin to the deep fascia, and these fibers you will have to cut with the knife or with the hand like this. Then you can reflect the skin from that area, and also you can see over here deep to the skin some fades, and also you will be able to see deep to the skin the nerves and vessels which are called as, in this way, deep to the skin you will find the subcutaneous vessels and nerves, subcutaneous fats, that is, and then also the fibers which connect the skin to the underlying deep fascia. We have removed the deep fascia from over here, and this combinedly, the fibers connecting the skin to the deep fascia and the subcutaneous fats, combinedly what we call it as wrongly is the superficial fascia, because the fascia means a sheet which can be cut and which can be re-stitched. But the superficial fascia is not like that. Anyhow, the name is given to it. So in this pectoral region, first the skin, and then when you remove the skin, you will find the fats, and you will the subcutaneous fat, that is the fats deep to the skin, the subcutaneous vessels and nerves, that is the vessel and nerve coming to the skin, and then another organ which is specially present over here deep to the skin, especially in female, that is the mammary gland or the breast, which is present only deep to the skin over here, between the skin and the deep fascia, and the mammary gland lies in the superficial fascia. We call it. That is, it lies between the skin and the deep fascia. In case of female, that we will study again separately. Then what you do, you clean again, you remove the skin from this area, reflect it laterally, and remove the fats and remove the breast tissue as well. Then you will find that these muscles you can't see, but they are being covered by a white sheet, complete white sheet made up of fibrous tissue, and that is actually the deep fascia. The deep fascia covers this muscle. You can't see the muscles. It is being covered by white sheet, and which is called as deep fascia, and in this region it is called as pectoral fascia. Now the breast lies between the skin and this pectoral fascia, or between the skin and the deep fascia. Then this pectoral fascia, look, you look, the skin of this pectoral region, it passes to become continuous with the skin of this axillary region. You can see the skin of this axillary region and skin of this pectoral region are continuous with one another. The same skin is continuous over here as well. In the same way, this pectoral fascia, or the deep fascia of the pectoral region, it also becomes continuous with the fascia that lies in the axilla, in the floor of the axilla, that is called as axillary fascia. Okay, then what you do, you remove the fascia, and when you remove the fascia, then you would be able to see muscles. Now you can see the sternum, and you can see this big muscle. This big muscle, this is pectoralis major muscle, pectoralis major. And then you cut the pectoralis major, deep to it, you will see this small muscle, that is pectoralis minor muscle. And then you would be able to see this small muscle which lies on the inferior surface. This is inferior surface, this is superior, okay, this is anterior, and this is posterior. And you can see this small muscle that lies inferior surface of the clavicle, that is subclavius muscle. So after removing the pectoralis major, you see the clavicle properly, then the subclavius thin muscle, and then this pectoralis minor muscle. And note another point, that this gap between this subclavius and upper border of pectoralis minor, this is being filled by a fascia, loose white fascia, that is being called as clavipectoral fascia. So in this way, the structures lying over here is the clavicle, the pectoralis major, the subclavius, the clavipectoral fascia, and pectoralis minor muscle. And note the point that in your own arm, you can hold these muscles, or this pectoralis major and pectoralis minor, in your own fingers. And this lower border of this muscle, this is called as actually anterior axillary fold. And then you can see there is a deep depression over here between the arm and the thoracic wall. This pit or depression, that is being called as axilla. Okay, and then you look over here again, you can see this acromioclavicular joint, and again this clavicle, this subclavius muscle, pectoralis minor and pectoralis major, these are lying over here. And then you look on this side over here, on this side again you can see this scapula, but this is the back. On the front of the scapula, on the ventral surface of the scapula, you come over here, look, on the ventral surface over here. Then you when you cut this anterior side, then you can see this ventral surface of the scapula. The dorsal surface, this is dorsal surface, this is ventral surface. In this concavity, when big muscle lies, in this concavity, this is subscapularis. And then at the lower part of subscapularis, then you can see one this big muscle, that is teres major muscle. And then one this muscle, the tendon, which is actually, look over here, this big muscle, this one. Look, this big muscle, latissimus dorsi, coming like this over here. Look, this latissimus dorsi coming over here. Look, from the back side, and then it comes onto the front. From back, it comes onto the front like this. In this way, if you put this posterior side of the axilla, you are holding in your hand the subscapularis, the teres major, and the tendon of latissimus dorsi. Okay, this was the introduction of the upper limb, and then we go on again to discuss and to detail of the parts and muscles of the upper limb. This is sufficient for today. Thank you very much.